Hello, everyone, and welcome to today's telephone town hall organized by your MPP for Nepean, Lisa MacLeod, to discuss and learn more about COVID-19. We're live this afternoon with Lisa MacLeod, MPP for Nepean. In addition, we are joined by thousands of constituents from across Nepean. I do want to let you know that really the focus you're going to hear first from your MPP, Lisa MacLeod. We also have on the line Dr. Andrew Falconer, President and Chief Executive Officer of Queensway Carleton Hospital, as well as Dr. Vera Etches, Chief Medical Officer for the City of Ottawa, and we're going to be hearing from them. But really the focus of today is to take your questions specifically on COVID-19 and any COVID-19 related issues that are on your mind. So if you do know that you're going to want to ask a question live on our telephone town hall, please press *3, that's the little star button, and the number 3 on your telephone keypad. You'll be connected with an operator who will get you in the queue to ask a question. So again, that's *3 to ask a question at any time. My name is Richard, and I'll be facilitating today's town hall. Again, you're on with Lisa MacLeod, your MPP for Nepean, who's made it a priority to engage and update you on the current status of COVID-19 and, of course, its effect on Nepean, Canada, and, of course, the world. It's our intention today to take as many questions as possible. So, again, if you know that you're going to want to ask a question, please press *3 to get in the queue, and we're going to try and get to as many questions as we possibly can in the time that we have. Hello again and welcome. Thanks for joining us. We're on with Lisa MacLeod, MPP for Nepean. As well with Lisa MacLeod, we're joined by Dr. Andrew Falconer, President and Chief Executive Officer of Queensway Carleton Hospital, as well as Dr. Vera Etches, Chief Medical Officer for Ottawa. And a reminder to press *3 if you're going to want to ask a question on our telephone town hall. With that, we're going to start with our opening remarks from your MPP for Nepean, Lisa MacLeod.
Thanks very much, Richard, and thank you all residents of Nepean for joining myself and Vera Etches, as well as Andrew Falconer. Good afternoon, and thanks again for joining me today on this live telephone town hall on the spread of the COVID-19 virus and its implication on our healthcare system and our economy. I know these are uncertain times for you and your loved ones, and I want to assure you that the health and well-being of Ontarians is our government's main priority. As your local MPP, I am committed to keeping the lines of communication open to help stop the spread of COVID-19, which is why I have asked Ottawa's Chief Medical Officer, Dr. Vera Etches, to join me along with Dr. Andrew Falconer, the President and CEO of the Queensway Carleton Hospital. In addition, I am running ads on most local radio stations and will also be mailing a special COVID-19 householder to each household with information on how to stop the spread of the virus and how the government is working to support our healthcare system, help students learn while they are out of school, and how we can plan to help people and businesses during this crisis. As a member of the Ontario Cabinet, I can tell you that the decision to declare a state of emergency and then to take the extraordinary measures of declaring the closure of all non-essential businesses was not taken lightly. But the decisions, though tough, were necessary. To that end, all actions we've taken to date have been based on the advice of Ontario's Chief Medical Officer of Health. That includes encouraging social distancing by requiring the closure of schools and daycares, requiring restaurants and bars to maintain delivery or drive-through services only, and closing non-essential businesses. We've passed legislation to provide job-protected leave for workers and families and have ensured families can buy the essentials they need by enabling businesses to receive deliveries 24/7 to keep their shelves stocked. Also, this past week, we announced our economic statement. To support people during this crisis, we're investing $75 million in support for low-income seniors by doubling guaranteed annual income systems payment for 6 months. This would increase the maximum payment to $166 a month for individuals and $332 per month for couples for a group of people who are particularly at risk in this pandemic. We're investing in emergency childcare options to enable parents who are frontline workers and our healthcare and emergency services. We're enabling one-time payments to parents to help keep children engaged by purchasing workbooks, educational apps, movies, and other tools. These payments will be $200 for each child 12 and under, and $250 for children with special needs. We are suspending OSAP loan repayments for borrowers between March 30th, 2020 and September 30th, 2020, leaving more money in students' pockets in these challenging times. Additional details will be included in my householder about specific supports for people and jobs. However, please know that you can access the self-assessment tool online at ontario.ca coronavirus. Again, the self-assessment tool online at ontario.ca coronavirus. Or, if you have a business-related question, we have a hotline set up at the Ontario government at 1-888-444-3659. Again, that business hotline number is 1-888-444-3659 if you are concerned about how the non-essential order may impact your work. And I know this can be a very stressful time for everyone. So if you require mental health support, please know you can access information at ontario.ca/mental health. Again, that's ontario.ca/mental health. More locally, I've convened a call with local city councillors, business organizations, healthcare, faith leaders, and food cupboards, as well as our legions, so we can assess who may need additional support at this time and who may be able to provide it. I anticipate these calls to be weekly and therefore would encourage all residents to reach out to my office at 613-823-2116 or any one of our city councillors if you need government support. In addition, through Ottawa Public Health, there are a number of other resources available which I will have Dr. Etches elaborate on. In the meantime, I'll move along with this call to Dr. Falconer of the Queensway Carleton Hospital so he can share with us the great work that our frontline healthcare workers are doing. Dr. Falconer?
Thank you, Minister MacLeod, and thank you for the opportunity to dialogue with the community that we serve. I'll bring you up to date with what's happening at Queensway Carleton Hospital. On March 17th, 10 short days ago, we canceled or minimized all non-essential or elective services at the hospital. That is, in our ambulatory care area where you'd normally come to meet a specialist, we're only seeing very emergent cases that need to be seen in person or providing virtual visits for the others. In surgery, we're only doing emergency surgeries. That is those that come in through the emergency department, and those surgeries that are deemed emergent by the surgeon. Those would be cancer surgeries, for example. So we continue to do those, and we coordinate with the Ottawa Hospital to make sure that we use our resources to best serve the needs of our community. In diagnostic imaging, all elective MRIs have been postponed until further notice. By March 19th, we implemented a visitor policy. We're trying to limit the number of visitors who could potentially have COVID to our inpatient units, where we have a largely elderly population that are quite vulnerable. So in the childbirth area, we're allowing one person with mom. For the inpatient units, we're allowing a care partner, so one person who's designated by the patient or family is being required to support that person, and one person visiting in the emergency department. We do have several provisions under compassionate circumstances that more than one can come in if it's deemed to be in the best interest of that patient. We've implemented some strategies for how to manage healthcare workers who are returning from foreign travel. They essentially, like everyone else, need to be in a 2-week self-isolation period. And in the hospital, we're practicing social distancing and virtual arrangements wherever possible. On March 21st, the province issued an order under the Emergency Management Civil Protection Act that allows us to facilitate the redeployment of all staff within various units of the hospital or even off-site. We're able to change the work hours and cancel vacations and leaves under this provision. We've limited the number of doors that folks can access the hospital from, so there are designated staff and patient entrances to the hospital. All staff and visitors to the hospital will be screened with a series of questionnaires. Anyone with a new onset of fever, cough, sore throat, or runny nose is denied entry to the hospital and sent for testing either in our emergency department or at Brewer. There's been a lot of concern about personal protective equipment for staff. And there are concerns that the supply chain is fractured, as a large part of our supplies come from China and Italy, who are clearly experiencing their own difficulties. I'm very impressed with the way the province is procuring large quantities of of the personal protective equipment. The staff need to feel safe when contacting COVID or suspected COVID cases. So we're allowing for staff masking in the emergency department and in the inpatient unit, and staff will always have access to this equipment to help them practice in a safe environment. I've been very impressed with community donations of protective equipment. We've actually had a fairly large influx from our surrounding areas from several partners. In terms of planning, I think most of us have heard that Queensway Carleton is involved in planning a West COVID clinic at the D'Aubrey Moody. We're ready to open that when the ministry tells us to open it. We've built a bit on the work we started with the Ontario health teams, and we've partnered with many local family physicians from Barrhaven, Canada, and Stittsville in particular, who are helping our staff man that clinic. In our emergency department, we have a specially sectioned off area that's dealing with potential COVID cases, and we're starting to look at opportunities to provide virtual care in the emergency department. On the inpatient unit, we're in the process of trying to create a fair bit of capacity. As we know, there will be an increase in demand for our services in the near future. A lot of our alternate level of care patients are being placed either in surrounding rural hospitals, and we're exploring other options. We've liberated some capacity within the hospitals. We're not doing a lot of the elective procedures, so we're able to create a fair bit in terms of new inpatient bed capacity. There's also a regional approach on bed management, so the beds will be managed across Ottawa in a coordinated fashion. We also anticipate a fairly increased need for our intensive care units capacity. So we're using an area of the operating room where we're able to add 10 additional beds, and we have plans to add others if necessary. We're purchasing several new ventilators, and there's a ventilator pool both regionally and provincially from which we're able to draw if the demand requires. There's also an ICU bed a regional distribution model, so we're making sure that we're maximizing the use of all of the ICU capacity in the region. The last thing I wanted to just touch on is a concern that I have for our staff's wellness. There's been a lot of work, and I mean our leadership right now is working 16 hours a day, 7 days a week. I do concern myself a bit about their burnout and potential for burnout, and we're implementing quite a few strategies in terms of wellness. There's an understandable anxiety in some healthcare workers about getting sick or making their family sick. So we have lots of wellness supports in place for our staff, along with ensuring adequate access to the personal protective equipment. We're looking at strategies if our staff end up in hospital for long hours to accommodate sleeping arrangements within the hospital or in local hotels. The province has provided an ethical framework for clinical decision-making in a time of limited resources, and also guidelines for triage in a pandemic. There are some decisions that may have to be made that are not part of a normal operations for the hospital, so we're very grateful for regional and provincial efforts to support our staff in that decision making. In the last call Minister MacLeod had, I put out a call for potential spiritual care for our patients' family and staff, and was quite impressed with the rallying from community partners to help provide some of that care in this difficult time. So I think I'll conclude my comments with that.
Okay.
Thank you very much, Dr. Falconer. Sorry, Richard.
Thank you very much, Dr. Falconer. I think we're going to hear next from Dr. Etches, and then we'll start going to questions. Just a quick reminder for those that are just joining, we're on a telephone town hall hosted by your MPP for Nepean, Lisa MacLeod, and who's been able to get and who have kindly agreed to give us their time right now to join Dr. Andrew Falconer, President and Chief Executive Officer of Queensway Carleton Hospital, and Dr. Vera Etches, Chief Medical Officer for the City of Ottawa. We are joined by more than 2,000 people on the line at the moment, and we're going to be going very shortly to your live questions. Please do press *3 if you want to go in the queue to ask a question. Again, that's the star button on your phone and your keypad and the number 3, and you'll get in the queue to ask a question. Sorry for that interruption. Lisa, please go ahead.
No, thanks very much. I appreciate that, Dr. Falconer, and I think I'll turn it over to Dr. Etches.
Thank you. So this is an excellent opportunity. One of the most important things we can do is share information and communicate in as many different ways as possible. For Ottawa Public Health, we will always have the latest information for the people of Ottawa on our website, ottawapublichealth.ca/coronavirus. I want to just highlight a few of the things we're doing. One of the key roles of public health is to do surveillance, to understand what's happening in our community. And so one of the pieces of information we have is from laboratory testing for COVID-19. When people have a fever and respiratory symptoms, the testing capacity is limited, so we're really focusing on making sure we can test healthcare workers, people who are in hospital or long-term care homes, and really the testing numbers are going to expand. We expect that we'll be able to do more of that testing into the future. The province is really has a plan to expand into private laboratories, which will really help and drop down that wait time people have had when they get a test. Sometimes that's been growing. We're going to see that drop as well in the future. But those tests, the reports that we give, of the numbers of confirmed cases are really the tip of the iceberg. We know that because there are undetected cases in our community. One of the ways we look at that and estimate what's happening is through models, and different models will tell us, not as precisely exactly what number of cases are in our community now, but they help us to understand and evaluate the measures we're taking to decrease transmission in our community. And so everyone's heard by now this idea that comes from the modeling that we need to flatten the curve, and that means for our hospitals, to make sure that Dr. Falconer's team is able to handle the patients that come in, we each need to do our part. There's really good data that shows if we limit our contacts with others, if we stay 2 meters away from everyone, we will be able to manage through this pandemic, and we will be able to protect our hospital's capacity. Another role of public health is that we do follow up on every case that is confirmed, and we look for those contacts, and we let those contacts know, and we do testing if needed. If the contacts have symptoms, we're trying to protect further transmission. And I can tell you, initially, we found in Ottawa for every one case, there were 16 contacts on average. That's exactly what we're trying to change with our messaging around physical distancing, so that one case does not go on to cause many others. I think the last role of public health that's key here is continuing to share information. And so again, I just want to encourage people, keep going back to our website. Minister MacLeod mentioned mental health support. It's very key. And we do have links on our website to resources right here in Ottawa that are virtual, ways you can get support for your mental health. We have other practical tools on our website, like how to protect yourself when you go grocery shopping. So really encourage people to use that material, and I'm happy to answer any questions.
Great. Thank you very much, Dr. Etches and Dr. Falconer and MPP Lisa MacLeod for your opening remarks. We're going to go now into our live questions. Again, we do ask you to keep your questions. We do have 2,000 people plus on the line, so we would ask you to keep your question as direct and as brief as you possibly can. and so we can get as many questions in and as well on the issue only at this point, please, of COVID-19. We're going to go first to a question from Susan, and she's got a question that we're going to ask Dr. Etches to respond. Susan, are you there?
Yes,
I am. Had a question about quarantine. Hi, go ahead, Susan. You're live on the line.
Thank you. So my question is, because I do have young children and I'm pregnant, and I haven't seen my sibling, my brother, in about 2.5 weeks. So we both quarantined at home. And I'm just curious, I'm a little confused as how to go about this. I'd like for him to come and visit us because he is an immediate family member, but I'm not sure. I'm a little worried. So if he stayed at home for 14 days and I've stayed at home for 14 days, can we then see each other?
Thank you for your question. The idea is to do as little visiting as possible because there's always a risk, and so if it's not an essential visit, we are asking people to limit those visits. When we talk about limit your contact to household members, we really mean the people you're living with in your house. We know that's not possible for everyone. People do need social support. People need, care, and people have to go out to work in essential roles. But the advice is the more we can each do that, it really will help us limit the transmission in our community.
Great. Thank you very much. We're going to move right along. Again, it's *3 if you'd like to get in the queue to ask a question. We're going to go next to Mary Lou, who also has a question about quarantine and self-isolation. Mary Lou, are you there?
Yes, I am.
Please go ahead with your question.
Okay, so myself and my husband are returning snowbirds. We're in day 7 of self-isolation, following the rules. One of the things, we're asymptomatic, and we have been in contact with Ottawa Public Health to make sure that we are allowed to go out for a brief walk for exercise while, practicing extreme social distancing, like being on the other side of the street. Since Tuesday, I've had 2 phone calls. I've had the nurses call me back telling me, yes, I still can, but today on the press conference, Dr. New said that everybody under quarantine, so that's where I'm confused. Everybody must stay home and in their backyard. So I'd like that to be very clear. That's a big question amongst a lot of my friends and colleagues anyways. So if you could help answer that question, that would give me a lot of relief.
Yes, and you're not the only one with this question, believe me. So what Ottawa Public Health recommends is exactly what you're doing, that you need to stay home. That means don't go out for grocery shopping. Don't go out for anything, except if you do have no symptoms, you're feeling well, you don't have any fever or cough, you can go out for a short walk for your mental health, for fresh air, and do practice that distancing from others. The messaging from the federal government, from the provincial government, isn't that specific about this, and so what we're doing locally is taking a balanced approach. If somebody's ill, if they're in social isolation because they're sick or they've been tested for coronavirus, that is not acceptable to go out for a walk. Now, I don't know what Dr. New said today, but I can tell you that the Federal Minister of Health indicated that they weren't meaning to be, they haven't provided all the clarity around this that they could. And the Canadian Public Health Officer for Canada, that's Dr. Tam, did tweet that it is okay for people who are asymptomatic to go out for a walk. So I think we're aligned with Dr. Tam and the Federal Minister of Health. If that's changed today, then we'll need to look at that again because it is a changing situation. But for us, we know we need to balance the approach.
Great. Okay, and again, a reminder to everyone, *3 on your telephone keypad if you'd like to get in the queue to ask a question. We're going to go next to Ross, who's got a question about drive-through clinics. Ross, are you there?
Yes, I am.
Please go ahead with your question.
Mine is to Dr. Etches. I guess my question would be, are there any drive-through clinics in the city? I've gone through since the 18th. I started exhibiting signs, had the sore throat, had the the headaches, had the fever, haven't had the cough. I'm a school bus driver. So in writing those rolling Petri dishes, I'm in contact. I run 3 runs a day, 2 times. My contact with those kids has been phenomenal. I guess my question is, why don't we have some drive-through clinics? I don't want to go into Brewer Park. I'm starting to lose the...
Sure. Okay. So first of all, I'm sorry that you're sick. I hope that you're feeling better soon. And what we recommend for anybody who is feeling sick, they're not sure if it's COVID-19 or not, is to use the provincial self-assessment tool that Minister MacLeod mentioned. So it's on a provincial platform. It's a self-assessment tool you can do online. If you enter in that you have symptoms of illness, the direction is going to be to self-isolate, which means you should be staying home and not going out. You shouldn't be going to work. This is to protect people because we can't say it isn't COVID-19. We don't have a way to say it is or it isn't. In terms of testing that you might access, that isn't currently available right now because we have a limited supply of testing. We have to prioritize healthcare workers, but we are expanding that capacity, and the drive-through is one option that's not off the table. I know the Queensway Carleton Hospital was able to do that really quickly one night when they were overwhelmed in the emergency room, and we'll be looking at expanding the options as we have more capacity. What is available for people who can't get themselves to the assessment center, who are in the high-risk groups, is that the community paramedics are helping us go to people's long-term care home residences or retirement homes, people who are in a high-risk population that can't travel to be tested. We now have this option of using community paramedics.
Okay, great. Thank you, Dr. Etches. And again, continuing right along, please press *3 if you'd like to get in the queue to ask a question. Really, that's going to be the focus as long as we can go here. We're going to go next to David, who's got a question about protective measures. David, are you there? Hello, David? Yeah.
Yes?
Yes. Please go ahead. You're live on the call.
I have a question about the two of us here. We're 72 and 69, and so we're at high risk, and we need groceries. Wearing a surgical mask and gloves, is that safe enough to go out? We don't have any symptoms or anything. Is that safe enough to go get groceries?
There are a number of measures that can help you get groceries more safely. So I think there's more detailed advice on our website. You can wear a face mask and gloves. Those aren't guaranteed, and you need to be careful with how you use those things because they themselves can become contaminated. So you always want to wash your hands when you come in from being outside grocery shopping. Wash your hands. Make sure you don't touch your eyes, nose, and mouth until you've washed your hands. And you want to, while you're out, stay at least 2 meters away from others. And the grocery stores are working on this. They're helping people with the lineups. They're putting tape on the floor to make sure people stand 2 meters away from each other. These are all things you can do.
Okay, great. Thank you. And again, a reminder, it's *3 to ask a question. I do also want to remind folks, again, that the focus of today is this call is going to be exclusively on COVID-19 and COVID-19 related issues. Of course, Lisa MacLeod's office is still open and for business, I believe, working from home, and of course can help you with any issues that you have right now and are there to be contacted. You can reach them at 613-823-2116 or by email at lisa@lisamacleod.com. We're going to continue with our live questions again as long as we can. This next question is going to be is directed to Dr. Falconer, and we're going to go to Norma, who's got a question about screening of medical staff. Norma, are you there?
Yes, I am. Can you hear me?
Please go ahead. Yes, we can. Loud and clear.
My question is about the medical staff. I heard mention during earlier in the meeting that the staff that do exhibit any sorts of symptoms will be screened or tested. Shouldn't we be testing the staff anyway, regularly and often? Seeing as I keep being told that, you can be still able to spread the disease even if you're asymptomatic.
Yeah, so all of our staff, including medical staff, are screened every day before they enter the premises, and they sign an attestation to the effect that they've been truthful. Any staff that exhibit any symptom while on duty report to occupational health or our emergency department for screening. So we are subjecting the medical staff to the same screening as everyone else.
Okay, thank you, Dr. Falconer. We're going to move on to another question by Lisa, who's obviously has got concerns that her husband has possible symptoms. Lisa, please go ahead with your question.
Hi, I had some concerns with regards to my husband's care and where he should go for care. He's had a headache for about 14 days and a little bit of a runny nose, but a real good chest congestion, cough. He has also pre-existing conditions, seasonal allergies and chronic bronchitis, and also with the head, he's had brain surgery before, so decompression surgery, and he said it's been about 14 days of full-on headaches, and Tylenol is not cutting it. So I don't know, should I just call the family doctor? We're self-isolating at home with the kids, like we're by ourselves. We're not really going out, and he said the headaches are getting worse, so I'm not quite sure. He does not want to go to the hospital. Does he need to get tested? Would he even qualify for that? It doesn't sound like it. I was listening to Dr. Etches' answer before. Not quite sure what to do.
It's Dr. Etches jumping in. I was going to see if Dr. Falconer wanted to answer that. Again, that sounds very challenging. I appreciate what you're doing to self-isolate. I think that's the right thing. But this is a situation where you should get some more assessment. Absolutely. I would call your family doctor. Most family doctors are really doing an excellent job of providing more virtual care. So doctors will do assessments now over the phone. They're finding ways to use video in some cases. I'm not sure what your doctor's office is available, is making available, but those are sometimes options, as well as going in to the office. If you're going into the office and you can, if you have access to a mask, he should wear that mask so that he protects others. People do like you to call ahead if you're going into the family doctor's office. That's always helpful, and so I think that I agree with you. It's probably worth finding some care, and you don't have to go to the hospital unless we're seeing some of these warning signs. So I would say to everyone, if you are feeling short of breath, like you're having difficulty breathing, if you are getting chest pain, if you are finding it hard to keep a level of consciousness, these are all emergencies, and you should go to your hospital emergency room. The Queensway Carleton Hospital will be there for you.
I agree, Dr. Etches. Thank you.
Great. Okay, we're going to go next to a question from Ken, is confused by some of the messages out there, particularly about gatherings and the size of them. Ken, please go ahead with your question.
Yes, thank you. Good afternoon. Thank you for this town hall. It's an excellent idea. Yes, on March the 16th, Dr. Etches put out an update. By the way, the public website's very good, but there was an update saying that Dr. Williams has advised canceling events over 50 people, implying that events under 50 might be okay. I haven't seen anything official changing that, and yet it goes on to say places like churches and faith settings, should close. It doesn't say must close. What really concerns us and our church community, we're in Nepean, is that we're getting these mixed messages from different levels of government. I can only suggest, I know it's not easy, that there is, we all sing from one hymn book here, and if situations like those described by Dr. Williams about gatherings over 50 should be avoided, I think that's long gone by now. Is that correct? I just would like to find out if that is still accurate or not.
Sure. As you can appreciate, the situation is evolving very quickly. Really, people tell me they're getting tired of the word unprecedented, but it is. So the 50 number comes from what Dr. Williams and the province have the ability to enforce under an order. And that is something where, because the province is in a state of emergency and it's an order not to gather more than 50, police can enforce that. What we've increased since that time is messaging that makes it clearer, I hope you take this away today, that the smaller the gathering, the better. And even if you can limit it to the people in your household only, that is ideal. And so it does mean, unfortunately, and we've seen church communities and other faith communities accept this, it means that we have to find different ways to connect with our communities. So we have seen people using technology or phone and other ways to stay connected, because right now, really, the less gathering, the better. So I hope that answers your question and supports people to do more. Thank you.
And if I could just thank you very much for the question, and thanks for being part of this town hall session. And I want to reiterate what Dr. Etches has said. As a member of the cabinet, we have taken the extraordinary measure of closing non-essential businesses. And I think the message is the less people gathering, the better. At the same time, social distancing if you are in a space. I've taken the measures of actually having my staff work from home as a result of this. And I can tell you when we decided to make those declarations, it was in the event, to really encourage lesser people gathering than what has traditionally happened. With respect to our faith community in Nepean, earlier this week, I had a group of faith leaders on with our city councillors and our BIAs and our food cupboards and the legions. And the faith community, by and large in Nepean, from what I gather from what they were telling me, are meeting either virtually online or taking on other aspects of this. They also have offered, which was very kind of them, to Dr. Falconer, the ability to help support some of the medical professionals at this time who may require more spiritual guidance at this time. So I wanted to add that, but I think it's really important to reiterate Dr. Etches' comments as well. So thank you very much.
Great, thank you. We're going to move right along here and get as many questions as we can in. We're going to go next to Joanne, who is a retired nurse and has a question about volunteering at an assessment center. Joanne, are you there?
Yes, I'm here.
Please go ahead.
So I'm a retired nurse. I am no longer registered anymore, but I would like to assist at the assessment centers because I can still do assessments. But I haven't been able to get in touch with anybody to see how I go about doing that. Any thoughts?
Yes, hi, it's Andrew. We're actually looking for folks like you. So if you go to our website, qch.on.ca, there's some information on how to do that. And all else failing, you can just contact me directly by email. My email's on the website.
And it's Vera, if I can jump in for others who may not be a nurse, but who want to volunteer, the City of Ottawa is coordinating volunteers through Volunteer Ottawa. So if people want to volunteer in helping others through this response, then Volunteer Ottawa is the place to go for the City of Ottawa. And I also want to reassure people who are afraid of volunteering because you're worried, if I volunteer, will I be exposed, that we are working with Volunteer Ottawa and the City of Ottawa to make sure that we do have the proper infection prevention and control measures in place for volunteers.
Great, thank you. We're going to go next to Sudhir, who's got a question about practical advice to boost the immune system. Sudhir, are you there?
Yes, I'm here.
My
question is, a majority of the focus to date seems to be on reducing the spread of COVID-19, and as we continue to do our part in that, can you give us any practical guidance in addition to self-quarantining? Can you give us any practical guidance on how we can boost our own health and immune systems to protect ourselves against this virus?
Great question, and I'm a family doctor also. I haven't worked in family practice for a little while, but it goes back to the very basics of making sure you sleep enough. Sleep is very important. Make sure you eat well, your fruits and your vegetables, your protein. Make sure that you are physically active. It really makes a difference. Even walking is an important physical activity for everyone to do daily. And so these things boost our immune system. There's good science about that, and that will help with any infection.
Great. Okay, thank you. And we're going to just get to our last couple of questions here before we go to closing remarks. We're going to Misty, who's got a question about people who have to, may need help getting groceries and that type of thing, and any services that are available. Misty, are you there?
Yes, I am.
Please go ahead with your question.
Thank you. So my question has to do with families who have people at risk in the family from, existing medical conditions. For example, my son has a heart transplant, and my younger son is in early stages of heart failure. So for my husband and I to go out and do groceries, I'm concerned about us becoming exposed, and we have been following all the recommendations. And we've tried to use one of these, online grocery service where you order it online and they go pick it up for you, and then they bring it to your house and drop it without contact. But the demand on that system right now is just making it not an option any longer. I'm just wondering if there are any community services available to people like us, or to seniors and that type of thing, who really need help in terms of actually getting groceries to their homes.
Yes, I think you're very. It's great to hear what you're doing to protect your family. I think you're right that when you have people at higher risk, you want to take all the precautions you can. And so there are volunteers who are doing this through community associations and through the City of Ottawa, Volunteer Ottawa Network. So I would say you can either reach out to your local community association to see if they are doing that in your neighborhood, or reach out to the City of Ottawa through 311 to see if you can be linked to a volunteer who can help with that. That is appropriate, and there are people working on that.
Okay, thank you very much, Dr. Etches. We're going to have to wrap things up, but I do want to let folks know before we do, and I will turn things over to Lisa MacLeod to give some concluding remarks here. Of course, if you do have questions, do feel free, please, to contact Lisa's office at 613-823-2116 or at lisa@lisamacleod.com, and they'll be happy to help you there with any questions or concerns. Obviously, Dr. Etches and Dr. Falconer have to go attend to their very urgent work. So with that, I'm going to turn things over to MPP for Nepean, Lisa MacLeod, to make some concluding remarks.
Wonderful. Thanks very much, Richard. And may I say, I owe a debt of gratitude, I think we all do, to our frontline healthcare workers, and obviously to Dr. Vera Etches and Dr. Andrew Falconer for the wonderful work that they and their teams are doing during this healthcare crisis. We've had over 2,000 people on the phone, and I believe we still have about 40 questions to go. So what we'll do is we'll make sure that my staff reach out to everybody that is on the line that hasn't got their question answered, so that we can do the best we can and triage that with our two physicians on the line. Again, I want to just reiterate that you can get accurate and timely information on COVID-19 by going through a series of these websites I'm about to mention. I'll do them slowly so that you can write them down. Ottawa ottawapublichealth.ca, ottawapublichealth.ca. The online assessment that we were talking about can be found at ontario.ca/coronavirus. Again, that is ontario.ca/coronavirus. I recognize how difficult a time this is for many people, not just on our physical health, but as we look at the economic impact and sometimes the self-isolation. As I mentioned before, there are healthcare supports for our mental health. Ontario.ca/mental health. Again, ontario.ca/mental health. 2 phone numbers I'd like to share with everyone. Obviously, because there have been non-essential shutdowns of businesses, you may have questions with respect to that. The business line is 1-888-444-3659. Again, the business line is 1-888-444-3659. Telehealth has been experiencing high demand, but you may want to call telehealth before visiting a hospital. And if you would like to do that, you can visit telehealth by 1-866-797-0000. Again, telehealth, 1-866-797-0000. We have 2 food cupboards that service Nepean. If you live in Bells Corners, Trent Arlington, Craig Henry, that is FAMSAC. They are available. You can call them at 613-820-5428. Again, FAMSAC, that feeds Bells Corners, Craig Henry, Trent Arlington, is 613-820-5428. The Barhaven Food Cupboard can be reached at 825-4505. Again, the Barhaven Food Cupboard is 825-4505. You can, if you want to reach out and volunteer during this period to help with groceries, to help with others. Volunteerism is very important at this time, and if you choose to do so, you can go to volunteerottawa.ca. Again, volunteers will be accepted at volunteerottawa.ca. We have a number of organizations that assist seniors. Right now, the Rito Osgood Seniors, Ross, and as well as Good Companions. And there is a meal delivery service that is available for those who are unable to leave their home. It's called OperationRamsey.org, and that is Operation, and Ramsey is spelled RAMZIEH.org. Healthcare right now is the number 1 priority in our government, and you may all be getting dings on your phone. Our government just announced about an hour ago that we would putting out an emergency alert similar to the Amber Alert, so your phone will be now receiving that. We will be doing a massive ad buy with the government over the next couple of days to remind people, particularly those coming from abroad, back to Canada, their requirement for self-isolation. And we will be working with a number of prominent and well-known Ontarians to help us get that message out. In the meantime, I know I have provided you with a lot of information there. All of those contact information will be available at my office at 613-823-2116 or by emailing me at lisa@lisamacleod.com. My team may be working from home, but we are always here for you. And so with that, Richard, I just want to say thank you to you and your team for facilitating this today. And again, my gratitude, and I believe all of our gratitude, to our frontline healthcare workers who have been nothing short of heroes during this time. So thank you.